Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Valsartan. Its brand name is Diovan. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Valsartan works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Valsartan. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Valsartan work? Well, first of all, Valsartan is a non-peptide angiotensin II receptor blocker. It blocks vasoconstriction and aldosterone-secreting effects of angiotensin II. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in hypertension or high blood pressure. We may see this medication used after a myocardial infarction or a heart attack, and it can also be used in the treatment of heart failure. With respect to contraindications or reasons we would not be able to prescribe Valsartan to a patient, we would not give this medication to a patient who had a hypersensitivity to Valsartan or any other component of the formulation. It also should not be used with aliskiren in diabetic patients. Note about dosing with Valsartan. So in the treatment of hypertension, if it was used as monotherapy, the initial dose would typically be 80 to 160 milligrams orally once daily, with the maintenance dose coming in between 80 and 320 milligrams orally once daily. In the treatment of heart failure, the initial dose would be 40 milligrams orally twice daily, and this dose can be titrated to 80 and then to 160 milligrams twice daily as tolerated. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Valsartan, so I'll go over some of those here now. 2 to 17% may experience dizziness, while over 1% may experience a headache. Hypotension or low blood pressure comes in between 5 and 7% of the time, and some patients may also experience a raised serum creatinine. 0.5 to 2.5% of patients may experience a cough. Now, some more rare but serious side effects would be acute kidney failure or angioedema. That's all we're going to talk about today with Valsartan or Diovan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found this information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.